Yo, what's up everybody? Dr. DeLorenzo here, owner and operator of Applied Kinesiology Center of New Jersey, located in the heart of Paramus. Yo, welcome back to another edition of Muscle of the Week. Today is Muscle of the Week 7. I like Muscle of the Week 7, the glute med, or the gluteus medius. Alright, so this muscle is cool. This is going to be a little bit more than a 3-minute video. It might be about 5 minutes. So, check this out. This is a cool muscle because I see a lot of it and the results are spectacular. Alright, so first off, the glute med is right here on the side of your hip and it attaches to a bump on your leg bone that's called a tubercle. I'm pretty sure it's your greater trochanter because the lesser's on the inside, and then attaches to the top of the hip. And it does this. Boom. That's what it does. If one of them is off, say this one is neurologically inhibited, say it's not firing, it lost its tone, there's a pinched nerve, and it's not firing, it will let go, whoosh, and this hip will hike up high. So you'll actually lean this way. If you stand on one leg, you'll lean this way. You'll lean away from pain or dysfunction, okay? When you squat, these stabilize your hips. So does your TFL, so do your glute max, so do your psoas, so do your abs. But if you're squatting and you have an issue, we're gonna check that. I usually see this muscle causing low back pain when there's a neck problem, okay? I had a patient come in one time who does P90X, I think 3 times in a row. If you're watching this, you probably know who you are. I gotta tell the story. And whenever I see a glute med weakness, I have to check liver involvement, which is pecsternal muscle or rhomboid muscle. Okay. So this patient comes in bent over in serious pain, sciatica. I mean, the whole 9, a look of desperation on their face. Dr. D, help me, okay? So I said, calm down, get on the table. Bing, bang, boom, I found it, and it was a liver issue. So there's something to be said with how bile salts work with your large intestine, which is an L5 viscerosomatic reflex association. So if you have a gut problem, it reflects on L5. If you have a liver problem with bile and it's affecting your large intestine, you can have a problem with L5. That's the connection, okay? So bing, bang, boom, I go through the system. I give my patient, I actually tested them with beta plus. This is bile salts. This breaks down fats. Your liver makes these, puts them in your gallbladder, and when you eat fatty foods, your gallbladder squeezes fatty acid enzymes, and it breaks down the fat, and then it goes all through the system. So people with glute meds that are off, that have liver issues, that need bile salts, this is bile salts. Don't just start taking these, okay? Don't just buy these, because if you don't have a gallbladder, you need different ones. If you have a gallbladder and you have a need for bile salts, there's a very specific way to take them. Don't just start taking them. If you are interested in what these do for you, or if you need them, I will find out for you. Okay, moving on. The glute med is an ovary uterus muscle. So from the embryonic stage of life, it grows from the ovaries and the uterus. I don't know how. That's just how you were made. So every ovary uterus muscle is a vitamin E muscle. Alpha, beta, delta, gamma tocopherol. Alpha tocopherol is like the most widely used one that your body uses. It's like a 90%, and then everything else is like 2.5%. A vitamin E deficiency will make you flex something, will show up if you actively flex something 10 times, and then it turns off, it becomes inhibited. So this is for like people that all of a sudden lose stability at rep number 8, rep number 6, rep number 10. They just come completely gassed. Or it's those people that are benching right? You've seen them. You're going to probably see it today. You're going to look out for it. And all of a sudden, their one arm starts to go up, their other arm doesn't go up, and their big, tough bodybuilder spotter is like, come on, man, push another rep. And the dude's dying over here, and he's not even moving. And then he gets up. What does he do? What does he do? What does he do? Like that. So I roll over. I'm like, I could fix that. And then they look at me like I'm crazy. Sure enough, they come on in, and we fix it. It's pretty cool stuff. Some people actually just are like, nah, man, it's an issue I had for a while. You trust me, you can't fix it. And I'm like, yeah, okay. All right. If you want to work out in pain, that's fine with me. That's cool. I don't like to work out in pain. I hate working out in pain. As a matter of fact, quick story. Let me digress a little bit. I went to Michigan 3 weeks ago and got adjusted by my mentor that taught me applied kinesiology. Taught me a lot of other things too. But he taught me applied kinesiology before I was in the doctorate chiropractic program. I had low back pain on the right for years. It was on and off. I would hurt it deadlifting. I would hurt it benching. I would hurt it this. And for those of you that are my patients, you've seen me out of whack before. And everybody would always say, well, why don't you go get adjusted? And the sad story is that I had to fly all the way to Michigan to get adjusted by my mentor because I've been to most chiropractors in the area, and they could adjust. They get me out of hairball situations here and there, but to actually get to the bottom of the problem and to have it fixed to where it goes away is what I needed. I called him. He made some time in the schedule for me. I went up there, and I had bilateral psoas weakness and bilateral glute weaknesses. He laid me face down after the whole examination, broke my upper cervical fixation, and then broke my occipital fixation. So my whole upper neck and left neck was rotated and stuck, and it was throwing out my glutes. Out of the dozen chiropractors or so that I've been going to for the last 5 years, no one has ever even attempted to come close to that. Basically what people say is oh yeah, I used to do muscle testing, or I used to do applied kinesiology. And I'm thinking, well, why'd you stop? So anyway, I don't even know why I just talked about that. It's just been on my mind for a while. So I feel great. I have zero back pain, by the way. So thanks, Doc. Appreciate it. Back to the glute med. So the glute med, not only can it be associated with liver function, not only is it associated with glandular, so besides vitamin E and beta plus, ovary glandulars found in simplex F is good. This is for females. Simplex M would be glandulars for men. So if you're a man, don't take simplex F. And if you're a woman, don't take simplex M. Good morning! Men with prostate problems also have estrogen handling issues. So you might have little boobs, might have fat sacs here. So men with prostate issues or estrogen problems that have a little bit of fat over here, a little bit of fat over here, or that cry often, have glute meds. That's another circuit. Lump at the head of the femur. So pain here. Ow, you think it's bursitis. That's a glute med issue. Could be a glute med issue. Doesn't have to be a glute med issue. Soreness at the iliac crest. That's here. Doc, it hurts. It hurts here. I have pain here. I'm limping when I walk. Now my foot hurts. I have heel pain. Check the glute med. Okay, ready? Wide-eyed females often have dropped uteruses that have glute meds. I found this before. And when I find it on women, they look at me like, dude, how the hell did you know that? And then we just fix it. We adjust it with respiratory patterns. That takes away low back pain. Explain to me how adjusting a uterus back into its normal position takes away low back pain. And then we have to support it with some ligament food and stuff like that. It could be a quick process, could be a 2-week process, could be a 3-month process. So that's the glute med. Let me explain something else here with the glute med. I saw somebody come in one time, and they were getting stretched by a guy who stretches them. And they had a really bad fever right after they were stretched. They had a right eye that was closing and a severe headache. Severe headache. They also had 2 glute medius that were off and 2 hamstrings that were off, which are L5, S1 nerves. So I go through the examination. There's no bowel, there's no adrenal, there's no lymph. It's just straight structural stuff. The pelvis was torqued, and C5 was down and backwards. So basically what happened to this patient was while they were being stretched, the stretcher stretched C5 and just totally torqued it out of its normal position, slightly sprained it, slightly dislocated it. You can call it a slight paralyzation. I like to use the word paralyzed because some docs want to use the word subluxation or dislocation. I like to call it a pinched nerve or a paralyzed nerve, because paralyzed means a loss of movement or stuck in a position and can't move. That's what happens to people when they come in pain. They're frozen. So check this out. The neck was torqued so bad that C5 was causing stenosis in the cervical spine, pushing on the anterior spinal cord, causing a torsion of the pelvis and a pinched nerve at L5-S1, causing loss of function of the glute medius and the psoas muscles or the hamstring muscles. What the hell? I mean, it's not just like, oh, your neck was out. And this is, so check this out. This is why when somebody breaks their neck, they lose feeling from the waist down. So that's how it's connected. So this is how when you have a low back problem, if the neck is there and the neck's causing it, fix the neck, leave the low back alone, okay? Some of you actually come in here with low back problems and we don't even touch your low back, we fix your neck, boom, you're good. Some of you have low back pain causing low back pain. So these are those tough to fix cases that I'm talking about. A lot of the times people come in, just quick crack, they're good. A lot of the times it's a little bit more in depth. That's the glute med muscle. So these are the nutrition for it. Listen, don't just take this stuff. Come on in if you have anything that seems like a glute med issue, and I will help you fix it. Thanks for watching Muscle of the Week 7, Glute Med, Dr. Dylan DeLorenzo. If you haven't been here by now, I suggest you come in, 201-634-8755. Have a great fall. It's the start of fall. I got my sweater on. I'm cold. Take care. Talk to you soon.